Welcome, everybody. Welcome to our Lunch and Learn, Creating a Culture of Safety and Justice, Learning and Unlearning Our Way Towards a Decolonized World. And this is an opportunity. I want to begin by just having a land acknowledgement. I want to invite you to join with me in the chat and put the name of where you are located. You can see in the bottom right a link. Placenames.mapdev.ca is a great website that gives you interactive opportunities to know how to pronounce and spell the specific location where you are located. Let's just take a moment to take a deep breath. If there is a window that you can look out, or a picture in your mind's eye of the land, just to take a few moments to take a deep breath and honor and express gratitude for this land where we are located. I would like to begin by acknowledging that I am speaking from Unama'ki, which is located on the ancestral and unceded territory of the Mi'kmaq, whose inherent rights were recognized in the peace and friendship treaties that were signed with the Mi'kmaq, Maliseet, and Passamaquoddy peoples from 1725 to 1779. This series of treaties did not surrender Indigenous land, resources, or sovereignty to the British Empire, but instead established rules for an ongoing relationship between nations. The treaties were later reaffirmed by Canada in Section 35 of the Constitution Act in 1982, and they remain active to this day. Let us take this time to pause in reflection and gratitude for the land where we live and work. We recognize the intersectional harms of colonization and affirm our commitment to translating this land acknowledgement into action. By seeking to implement the recommendations of the Truth and Reconciliation Commission's calls to action, we commit to doing what we can to becoming better treaty partners. We commit to learning and to unlearning. Let us take this moment to pause in gratitude for all who have and continue to heroically care and advocate for this beautiful land. May we join them in this sacred work. Let us ground ourselves in the wisdom of the land-based Mi'kmaq teachings and values that we must all begin to learn. Let us work to decolonize ourselves, our practice, and this community that we share by working for justice as an expression of our gratitude for being here. Let us take a deep breath and recenter ourselves away from the violent ways colonization fills our world and fills us. Let us take a deep breath and work on letting go of the racism, queerphobia, and unconscious bias that is everywhere, inside and out. May our session today lead us to be in right relationship with this land and with one another. Wulalu. Thank you all. When we acknowledge the land, we must also begin to acknowledge the wisdom of this planet and align ourselves with its truths. When we ground ourselves in the wisdom of this planet, acknowledging those forces that seem like gravity, and reflecting upon those issues that are manufactured, we begin to understand the deeper wisdom that was repressed, the deeper wisdom that can heal us when we pull back the veil of the stories we are told, when we see the systemic forces that impact us every day, when we allow ourselves to unlearn deeply, we begin to see more clearly the intersectionality of oppression and the interconnectedness of hope Today, let us exhale out all that keeps us from the justice, equity, and healing that each of us deserve. Today, let us ground ourselves in the wisdom that can teach us the path to reconciliation and wholeness. And so today we're talking a little bit about our healthcare system and some of the challenges that we see. You can see here two cartoons, two images, one that speaks to the challenges of our healthcare system, and then this other one, as you see the typo on the wall that this person sees, instead of brain surgery, Brian surgery. And a little typo, a little mistake. We all make typos and mistakes. You might see some typos and mistakes in this PowerPoint. I will make mistakes because I am human. And as somebody who's human, I make mistakes. And healthcare is provided by human beings. And that means that healthcare sometimes has mistakes. The question is, how do we deal with mistakes? And that really is the core issue affecting safety and affecting our healthcare processes. It's one of the factors that is associated with burnout, because burnout is an example of what happens when we try to do too much. When we try to do too much, we're juggling too much, we get overwhelmed. When we try to be perfect, we get overwhelmed because we're not perfect. We make mistakes. And we live in a world that expects perfection, and we've internalized that message. So because we've internalized that message, when we make mistakes, and it could be a typo, it could be any number of different things, we sometimes get blamed or are afraid of getting punished. We feel shame or guilt, and sometimes the instinct is to cover up our mistakes with a lie. So one of the things that I've heard many of you, social workers and other healthcare providers in Mi'kmaq say, is that sometimes you see issues of safety come up, and if a mistake is made, you might see healthcare providers agree on the version of the story to put in documentation. So of course, this is a big healthcare issue that can lead to safety issues, but it comes from colonization and from the ways in which we were taught to be afraid of not being perfect. I once had an opportunity in the United States to witness a surgery. And the surgery that I witnessed was a kidney transplant. It was part of my training, and I was in a hospital, and I got to witness a kidney transplant surgery. And at the end of that surgery, this was at New York Presbyterian Hospital. At the end of that surgery, there was a sponge that was missing. They did a little counting, and there was a sponge that was missing. And everyone got on their hands and knees and went everywhere in the surgery unit looking for that sponge. They couldn't find it. And they figured they must have miscounted the sponge and made a mistake. Only then the person who still had a sponge in them got sick. And they never told that person what happened, but they did wind up going to fix it. The ways we cover up our mistakes, little mistakes, big mistakes, cause a lot of safety problems for people. And it also contributes towards the burnout of healthcare providers. So one of the things, for example, the World Health Organization is pushing is this concept of patient safety culture. And that involves reporting and learning from errors. So when we make a mistake, instead of covering it up, which is our instinct, which is part of how we've been colonized, this need to be perfect. If instead we say, hey, there's this mistake, let's figure out why this mistake happened and what process we can create to prevent those mistakes from happening again. If we could use the safety culture process, then what we can do is we can create a better, safe environment, not only in terms of patient safety, where we can figure out where we went wrong and make it better, but also safety, emotional safety for staff. Blame-free environments. That is the key part of any organizational culture that can help promote safety. The safety of patients is interconnected with the safety of staff. The safety to recognize that we're human, we might make mistakes, and we need each other in order to be able to figure out, what am I not seeing that you're seeing? And so teamwork is actually a whole process. Some of you might know that in a previous life, I was living in the United States in Kentucky, and I was actually vice president of several hospitals. And one of the things that I got to be part of was safety huddles, where we would gather together in every department and be like, okay, we have 2 people on our floor with the exact same name. That creates a safety concern because it's very likely that human beings might mix them up and maybe one person gets the other person's medicine. So we would have little safety huddles and we would discuss what is going on in our unit that is a safety concern. And then we would report up, there would be a hospital-wide safety huddle every single day, where there would be social workers, chaplains, doctors, pharmacists, computer technology people, engineers, all nursing informatics, every unit, every floor, dietary, cleaning, housing, every single department and leadership would gather together for half an hour every day, and every safety concern in every individual unit would get reported up to the next level. And then we would say, oh, I heard that you have this concern on unit 4, let's say. Well, how can pharmacy make sure and be aware? And how can we begin to understand that what I'm doing can impact the other? That became the beginning of this blame-free environment that does this open communication across all levels, this true teamwork. And it also allowed, for example, computer programmers and informatics specialists to be designing computer programs to support human beings in creating special processes to prevent error from being replicated, and the same patterns happening over and over. It also facilitated communication, because sometimes there'd be one unit that would be mad at the other unit. For example, why does the emergency department always send us people and they don't do this X, Y, and Z? So they would understand what had happened in one unit and how that was impacting the other. So that built more of a culture of understanding. So for example, if the pharmaceutical department was struggling with medicine shortages because there was no medicine of such and such type that was available across the country, and the unit was like, why did you suddenly stop sending us medicine in this way, without understanding what the other unit was struggling with? This is not just true in hospitals, right? This is true in human life in general. You could be stuck behind someone in traffic who is, for example, going slow, and be like, come on, learn to drive, and not know necessarily what might be going on in that other person's car. Maybe they are having a heart attack and they're struggling. Maybe they are having something else going on, car problems. We assume sometimes the worst, and that's part of decolonizing our brains. The ways in which our brains were taught to assume blame or to cover up Because if we are ashamed of our own imperfections, then we don't talk about them. Then everyone thinks, because we live in silos, that we are in our own world. And so creating patient safety culture involves all of these components. But the first and most important part is blame-free environments and us having less shame so that we can start reporting our mistakes and embracing them as opportunities to learn. All of that is a way to counterbalance burnout. Burnout is part of what is killing our healthcare system right now, but it's killing each of us as human beings. And so this connection between these two concepts is what is desperately needed for our healthcare environment. It is a failure to bring that together that causes all of us in our silos to have moral distress, which then is amplified by vicarious trauma, secondary stress, personal experiences. So, for example, nobody listens to me. And that's a feeling that a lot of us have. And maybe those feelings are amplified by personal experiences, how I was raised as a child, what might be going on in my marriage or relationship. Maybe it's amplified by intergenerational issues or trauma or prejudice or discrimination. And all of those things cause us to feel like we can't do what we were hired to do, what we were trained to do. And that causes both ethical distress and moral challenges, moral injury. And a lot of that comes from the blame and shame environment that causes us not to be able to think critically by having other people's voices and perspectives. And that leads to crisis. And the crisis that we are experiencing, whether it's in healthcare, whether it's in our professions, whether it's in our society, we assume the worst. We assume that other people think the worst. We have so much blame and shame that is dividing us. And we're all caught in the middle of a system whose silos are breaking down, but we are struggling to hold everything together, which is the burnout piece. And it is not a safe long-term strategy. And every discipline is paying the price. Social workers are amongst those that are paying the price. And it's because we're still locked in our silos instead of doing those kind of broader safety processes that involve learning about just culture, which is what today's session is about. But it's also contributing to our burnout. So let's talk just a little bit more about burnout and the role of urgency in keeping us on high alert. Adrenaline, anxiety, I'm afraid of getting judged, I'm afraid of getting blamed. And that contributes to shame, that contributes to each of us locking ourselves in silos and not hearing the ways in which we are all interconnected with one another, right? So we began with a message of acknowledging the land. How do we align ourselves with the truths of that land as part of our own decolonization? It comes from recognizing that if I'm struggling with something, other people might be struggling with that same thing. So, for example, if there are two patients with the same last name, the emergency department dealt with it, the floor dealt with it, dietary is dealing with it, because what if, for example, one of them has a food allergy? The pharmaceutical department is dealing with this. Each of us are dealing with the same issue, but from a separate perspective. And when we can realize we're not alone in it, that we're all working on it together, that's the beginning of liberation. That's the beginning of recognizing that we don't need to do it all alone. That's the first step to not burning out. The next is also recognizing what Tricia Hersey talks about as grind culture. So some of you might know rest is resistance. I strongly recommend that you look into it, read it, Google it. Rest is Resistance, a Manifesto. We had it as a book club, and we were giving it away for Social Work Month and as prizes for our conference. But it is about the role of urgency culture in causing us to be part of that burnout, which keeps us from thinking critically, which keeps us running so fast in our silo that we don't have time to reach out to one another and unite in solidarity against the larger systemic forces. And that is also contributing to a lack of safety for each of us. So dismantling urgency culture is part of a conscious effort of decolonizing ourselves and our organizations. And that is one of the ways that we can work towards building a just culture and a safety culture. I'm going to talk a little more about specifically what just culture is, because it's actually all outlined. The steps of creating a just culture and a safety framework have already been organized and tested and validated through the World Health Organization, through hospitals across the world. And it's what we need to be thinking about, not only for our healthcare system, but even for the social work profession, even for the Nova Scotia College of Social Workers, even for ourselves as individuals. How can we dismantle urgency culture, dismantle a culture of shame, dismantle a culture of trauma, fatigue, anxiety, repression, the ways in which we believe that we are alone in this, and the ways in which we sometimes stay in our silos with tunnel vision. So this is actually part of, and if you read Rest is Resistance, you'll see characteristics of a white supremacy culture that privileges perfectionism as a strategy that creates shame and complicity, because then we don't admit when we're wrong. And then each of us continue to be stuck in a system that is oppressing each of us in unique ways. So here are a couple of characteristics of this perfectionism, white supremacy culture that if we want to decolonize, right, a lot of times I hear some social workers or some humans say, well, decolonization is really something only about Indigenous people. And it's not. The colonization of the land and its people is tied to larger white supremacy, capitalist forces that are causing us to turn on ourselves and one another through lateral violence, through competing with one another, and through perfectionism. And perfectionism in particular is very damaging to safety, because we're human and we make mistakes, whether it's a typo or whether it's getting two people confused. How we deal with those mistakes is going to be what makes or breaks us. So perfectionism, a sense of urgency, defensiveness, focusing on quantity over quality, the belief there's only one right way, individualism, I'm the only one, fear of open conflict, power hoarding, either or binary thinking. Even the notion of binaries is a very colonial concept, right? Just even the notion of binary genders, two-spirit individuals, other cultures have more than two genders. The notion of binary, either or, good, bad, black, white, that is missing out on the fluidity of human existence, which we just have to look at nature and see that there's so many more variations of ways of being and knowing. Paternalism is another characteristic of white supremacy culture. This notion of progress is about being bigger and better. This notion of objectivity, all of these things are characteristics of this culture that if we say we want to decolonize, that if we say we want to work towards truth and reconciliation, then we have to begin to recognize the ways in which this is actually part of what is breaking us. Bias, there's a lot of forms of bias, but one of them is the ways in which we are afraid to be wrong, right? So fragility, this fear of being wrong, is actually causing deep harm in healthcare and in the world more broadly. We have this bias to try to hide our imperfections that has been taught to us by the system we live in. And that reinforces other forms of silos and bias and prejudice, because all of us that are in our silos are feeling like we're the only ones going through something. But this is one wheel amongst many. Our professional development committee is working on creating a Mi'kmaq specific approach to this. So this one has been borrowed from elsewhere, but we can see how we're actually far more diverse. But because we don't go outside of our silos and learn from one another, we all have very different perspectives of what is actually going on. So decolonizing is not about saying I'm right, you're wrong, but recognizing that it's the system that is to blame. That is the core part of dismantling a blame shame culture that is the obstacle to a safer culture, a just culture. So let me talk a little more about just culture and what we need to be doing to decolonize ourselves and our systems in order to improve safety and justice. And the first thing is we have to unlearn perfectionism. So safety culture, and you are welcome to Google it, there are millions of articles about it, is a flexible culture. It's a culture in which an organization is able to reconfigure themselves in the face of high tempo operations or certain kinds of danger. It is a learning culture with the organization being willing to learn and competent to draw conclusions from safety information systems and willing to make changes. It is a just culture. It's an atmosphere of trust in which people are encouraged and rewarded for providing essential safety related information. A reporting culture where people do report not just their mistakes, but their near misses. Hey, I was getting ready to do something to give the right medicine, give this medicine to someone, and somebody else caught me. So no harm reached the patient, but I'm still going to report my almost mistake, because there's learning to be had from our mistakes. What was going on? What happened right before I almost gave the wrong medicine to the person? Did I take two patients' medicines in the same hand and get them confused? And it took somebody else to catch me to be like, oh no, the blue pill goes to the person next door. What was going on, right? And this, I'm using nursing because it's a very, very easy example, but every human being is human and makes mistakes. And so understanding safety culture is understanding that adverse events come from human errors, and they are all impacted by systemic issues, by leadership philosophies and values. And fundamentally, if we want safe outcomes, we need a learning culture that recognizes that human beings are the ones delivering care, which means that we all sometimes might make mistakes. And we don't get better by blaming ourselves or by being ashamed, but by stepping outside of that shame to talk about how perfectionism is actually causing harm. So this is what's sometimes called the Swiss cheese model of healthcare. So we already have a few processes in place. For example, 2 patient identifiers. I register to go give blood, they take my name, they give me a card, then I go and the person says, tell me your name, tell me your birth date. That's an example of a couple of layers of extra protection to make sure that I am getting the procedure that's right for me. But the problem is that there's always going to need to be more layers because we're that human. And so whenever there's a mistake that could happen, we can learn from it and put in an extra layer of protection. Now, no layer is going to be perfect. They're all going to be like Swiss cheese slices because they're designed by humans. The best thing we can do is try to layer our Swiss cheese protective methods over ourselves so that we can try to avoid patient harm. But sometimes the holes are going to line up in just the right way, and there still might be patient harm that happens. When that happens, there is a natural instinct amongst all of us to assume the worst. They did it on purpose. This is, and then there's blame and shame, and we cover and we hide. Assuming positive intent, recognizing that we're human, recognizing that it's not the person, but the system that is to blame, whether it's the fact that the person is having to work extra jobs to pay for their rent and they're exhausted and they're overworked and underpaid and under-supported and under-resourced, whether it's because there could be a computer program that could be instituted or created to avoid that. There could be a new workflow that could be designed that involves extra people doing some of the checks for one another, whether it is any number of different policies that could be adapted. If we could think creatively and embrace mistakes, not for the outcome, which we shouldn't obviously embrace, but for the learning opportunity that can come from that. This is part of safety care, safer care. It means creating safer systems where there's no blame or shame or punishment, and identifying opportunities in the process of the workflow, planning to improve that process, then making those changes, then reviewing to be like, is this working? What's working that we did expect? What's working that we didn't expect? And that is what's called the continuous improvement cycle. This is one method that comes from the field of engineering, but because of colonization's division of knowledge into separate silos, we have engineering that is separate from social work, that is separate from medicine, that is from doctors, separate from nurses. We are all in silos. And creating opportunities for teams to come together and be like, what can I do differently? We're all human. What can I learn from this danger, from this concern, that from this injury, from this mistake? How can we work together to fix it? That is how we create safer care. So it also involves looking at a positive safety culture, the learning culture, the willingness to draw conclusions from safety, to implement reforms, being rewarded and encouraged for providing safety information, including reporting mistakes and not being punished for it. So the blame culture that we exist contributes to urgency, contributes to shame, contributes to mistakes, contributes to moral distress, contributes to burnout. Stepping back, recognizing that it's a system that we've inherited that was put into place by colonial roots that pre-existed our being born. We all were born in a colonizing system that expects perfection, that divides us against one another, whether it's our identities or whether it's our professions and our schools of knowledge. We're being divided against one another, and we have to recognize that we're all part of a larger whole. So elements of just culture involve investigating for safety at all times, flattening hierarchies and listening to everyone's voices, embracing different perspectives, championing new ideas of doing things, being consistent and fair, always looking for improvement, welcoming challenge, being transparent, trusting, encouraging curiosity, and always working to learn. It involves rewarding safety concern reports, looking at all of us at each level. So what's true on an individual level, and here the slide only talks about the unit level or the department level or the organizational level. But even on an individual level, how do we handle mistakes? How often do we say, oh my gosh, I'm so stupid, I shouldn't have done that? The ways we talk to ourselves contributes to that moral distress, but it also reinforces this culture. So just culture has to begin with ourselves or with the people around ourselves, remembering, reminding ourselves, doing the social work thing of refocusing on the structure. We talk about psychosocial and structural factors in healthcare. That includes the blame culture, the perfectionism, the shame. Those are part of the culture that we need to change to get to a just culture where diversity is celebrated, where everyone's voice matters, and where when we get things wrong, whether it's I said the wrong pronoun or I gave you the wrong medicine, whatever it is, let's figure out, well, what do I need to unlearn that is getting in the way of my providing safer care? There's so many silos. So you can see here, this is like a sample silo of the way many organizations are designed. And this is part of the colonial system. So if we do a land acknowledgement at the beginning of our session, we have to actually translate that acknowledgement into action, which begins by dismantling all silos and dismantling cultures that thrive on punishment, blame, shame, and perfectionism. Loneliness is one of the biggest public health emergencies that is repeatedly being shown through data across Turtle Island. And instead, we have more silos and fragmentation. And when there's a problem that we notice, we assign a couple of people to go off in a corner and keep working on it. So we just keep fragmenting ourselves more and more. And unfortunately, this is part of the strategy of colonialism, to divide and conquer. There are other methods. For example, lean process improvement, which is drawn from engineering principles, brings together the whole team to say, well, what do you see? Let's look at the current process. What is the current process of our healthcare system? Does it look like this slide where everyone does their own thing? What would look better? You who works in dietary, what do you think should be there? You who's the doctor, what do you think should be there? You who's a social worker, what do you think? And then let's not forget the most important person, the patient, their voice. That's how we go against this fragmenting, shaming, blaming, divisive approach, which is what actually contributes to competition, lateral violence. As we compete for the same scarce resources, it facilitates prejudice because we don't see how similar we all are. Because you see, oh, that pharmacy department, they never send us the right medicine. They are always changing the way they send things. Why do they do that? They're so stupid. And then we come up with versions of the story that we tell ourselves. And it could be true for the pharmaceutical department in a hospital, and it could be true with other settings as well. The stories we tell ourselves are usually taught to us by systems that want to encourage blame, shame, perfectionism, scarcity, urgency, adrenaline. So Dr. Michael Yellowbird talks about neurodecolonization. And he talks about meditation and mindfulness and indigenous practices, land-based practices. Many cultures have similar practices. How do we slow ourselves down, reconnect to the land, reconnect to our deepest sense of self, and realize that we are all in this together. And when we get things wrong, it's not because a person did it most of the time, sometimes it is, but a lot of the times it has to do with a system that we inherited that is causing us to have tunnel vision and not see or know what we're not seeing. So here is a slide that you can find. If you go look for just culture, safety culture, good catches are celebrated. Mistakes are celebrated as an opportunity to share knowledge, improve conversation, and learn and figure out ways that we can work together towards common goals. A good catch can prevent accidents. One of the reasons we're in crisis is because we are not working together to learn from mistakes. We're so busy running to catch up. But there are technology, there's dashboards and analytics to look at near-miss reviews, action plans that can be done. The first step, though, is you'll see in the aqua at the bottom, staff have to be empowered to share learning about near misses and mistakes, to have good catches be celebrated instead of blamed, for us to not be living afraid. So there's documents that already exist. Whatever organization we're in, good catches. It could be even in a family, right? Like, oh my gosh, you didn't take the garbage out today. That's it. You don't care for me. You are taking me for granted. The stories we tell ourselves, right? And maybe we just need a better process for maybe a little sign on the door. Did you remember to take out the garbage today? Right? Like, I'm just saying this is the same method, the same process, the same issue. It manifests on individual levels, and it manifests on a professional level, on an organizational level. And it begins with getting rid of our shame around mistakes, getting rid of our tendency to blame when others make mistakes, recognizing that those are part of colonialism's perfectionist strategy to keep us divided against each other, silent and covered by shame. And instead, let's talk about our near misses, our mistakes, and let's learn from them. Let's maybe develop data tracking mechanisms so that we can maybe even talk to our employers about reporting software that exists. All of this exists already, but we have to first be willing to try to not let ourselves get swallowed up by the shame that is part of colonization, the urgency that causes us to be so burnt out and exhausted that we can't do one more thing. This isn't one more thing. This is about the decolonization. If we just go back to the very basics of the land, of our humanity, of our interconnectedness, if we focus on grounding ourselves, taking deep breaths, we can recenter and we can ensure safer care for all of us. This is part of what it means to be a social worker, right? We are trained in ecological systems theory. We are trained to understand that the individual, the microsystem, the mesosystem, the exosystem, the macrosystem, the chronosystem, that these are all interconnected. We understand the power of structuralism, the structures we are in. And yet, we're not looking at the blindfolds that happen with our intersectional silos, the ways in which we are not seeing it. We have to bring all the other people here. And one way to do that is talking about how rest is resistance, talking about how blame and shame and guilt is part of this perfectionist false value that is keeping us from embracing our humanity and the fact that as humans, we are going to get it wrong and we need to lean on each other and learn and together from that begin to slowly dismantle the system. But the first step is unlearning the shame and blame that contributes to moral distress and leads to the concerns that we have. And when we do see that, and when we are feeling that moral distress, that's an alarm bell that means that we need other people to come. We need extra eyes on the problem. We can't just do it alone. So that's one of the reasons why we as an organization, Nova Scotia College of Social Workers, have grounded ourselves in the moral distress of our members that was identified in our repositioning report, and begun to encourage our members to do two things: to link up with other people. One is an ethics consult, Nova Scotia Health Ethics Network. If you are aware of ethical concerns where, for example, healthcare providers are not listening to each other, they're locked in a blame-shame dynamic that is causing harm or might cause harm to a patient, there's the Nova Scotia Health Ethics Network, or you can reach out to us. And then the larger systemic structural issues, we are working with other healthcare providers, doctors, psychologists, nurses, occupational therapists, physical therapists, chaplains, so that we're not alone, that together we can begin to heal ourselves and create a safer world for all of us. There are no failures if you learn and grow from your mistakes. Then there are only lessons learned. How do we deal with mistakes? We need each other, and the first step is being grateful for feedback. If I make a mistake, then I want to be corrected by that. How can I unlearn, relearn, recognize that it's not my fault if I've been blindfolded by a system, and instead of reacting with embarrassment, gratitude. Oh, how did I miss that? And what can I do differently so I don't miss that again? That is a culture of safety. That is what's called a just culture. A just culture means that we're all just trying to do the best we can, and we're focused on justice, and it means that we aren't going to blame each other. We're going to work together to create safer care for everyone. And that also is what can help us come together in advocacy and in the ways in which we provide care. If we all join together in this shared message, which is part of our Advocacy Day every year, mark your calendar now for March to celebrate Social Work Month. We will be having our third Advocacy Day, where we bring together other healthcare providers and first voice individuals. That's the most important piece. We are partially all exhausted because we are all advocating on behalf of others. We need to get first voice integrated. We need patient family advisory committees in every hospital. We need first voice in every school, in every organization. And we need to be learning from them. Where did we go wrong? Why did we go wrong? Okay, I'm not here to defend myself. It's not personal. I was just following instructions. I was raised in a system that didn't teach me to see things from your intersectional lens. I'm not going to be blamed. You might be even angry. It's not at me, it's at the system. And then what can we do to learn to slowly begin the dismantling of the current siloed colonizing system that pits us against one another, to say, what can we learn from how every human's needs has to be respected? That is the culture. And it begins with not taking it personally when we make mistakes, and not blaming, not getting blamed, working with to create a management strategy that and advocating for it that focuses on just culture and safety principles, so that we're all safer, because we're burning out if we don't. may be familiar with our Advocacy Day toolkit that we did in partnership with the Nova Scotia Legal Information Society that invites you to contact your MLA if you are aware of concerns, because a lot of times there are structural issues that are going on, for example, housing, that impacts things. The structural issues of perfectionism, blame, shame. Tell your MLA, I'm really interested in making sure that there's just culture and safer care in our hospitals, that this is something that I want to see. MLAs will do what they think. If you say, I want to work on prejudice and bias and discrimination and hatred and I want intersectional hatred, I want first voice representation in healthcare to reconfigure, decolonize our healthcare system, you can do that. Stay tuned. We're going to be focusing on that as part of our Advocacy Day for the coming year, as we did last year. More Than a Diagnosis is another example of us trying to come together to look at the structural determinants of care and work to advocate for changes. We will be more effective in our advocacy when everyone joins in us together. But everyone's going to join with us because we're already building those relationships within our organizations. It comes from learning to hear every voice. And with that, I am going to stop recording and we will have a discussion.